Today I would like to do a presentation for you promoting healthy lifestyles for nurses. Would patients be surprised to find high-calorie desserts and snacks in the patient's lounge? Should patients have confidence in nurses who are overweight or obese? In research conducted in 2008, it was found that 54% of nurses were overweight or obese. Nurses are educated to provide patients with health advice. Should nurses also be role models for that advice? Today, I will discuss reasons for unhealthy behaviors in nurses and also how they can be improved. Nurses can practice healthy behaviors in several ways. The three main points I would like to talk about today are the work environment of nurses, choosing healthy dietary options and also routine exercise, and taking advantage of wellness programs offered by employers. The work environment for nurses has a number of negative effects, and I would like to look at the visual aid here to discuss it. The nurse in the center, you can tell she's very rushed. She has a stressed look on her face. She has several different patients that need something at the same time. She's got one who needs pain medicine, another one who needs a new IV start, and she has another patient whose IV pump is alarming. So she feels like that she needs to be in three places at the same time. The nurse over to the left, or the right, she has just had a discussion on the phone with the doctor. You can tell that her face is red, she looks angry, her arms are crossed, and from the caption there it looks like the doctor has yelled at her. And the nurse over to the far left looks like she's been working for several hours and she is hungry. And she's going to pick something quick and cheap. So she's got a cheeseburger, pizza, donuts, Coke. She's got all kinds of things there. She just wants something quick and cheap. So as you can see from that visual, there are a lot of stress. There's a lot of stress in the work environment for nurses. The stress that nurses reported in the literature was physical, mental, and emotional. That was in a report conducted where nurses rated their professional environment. Nurses also reported that rotating shifts and working long hours had a lot to do with that stress too. In addition, verbal abuse is another problem. Nurses experience verbal abuse from colleagues, from doctors, patients, and families. And in the research, it's been found that verbal abuse is equivalent to bullying. The second topic I want to talk about is healthy dietary options and choosing exercises. Night shift workers reported that vending machines was usually their only source of food at night, and that was not usually healthy foods. It was suggested in a study that the vending machines be stocked with healthy dietary options. Also, many times nurse leaders will provide pizza, donuts, unhealthy snacks at staff meetings, and it was also recommended that those nurse leaders bring healthy dietary options for the nurses. And it was also recommended that the nurses each week take turns bringing different types of fruit to stock the nurses' lounge. Also, decreased physical activity is also noted in the literature, and many times it is a result of back injury. Nurses also reported that long hours working with less than adequate staff caused fatigue, which created a lack of motivation for self-care. It was suggested in the literature that facilities provide places for nurses to take power naps to help with coping and to decrease stress. The third topic that I want to talk about today is wellness programs that are provided by the employer. It has been found that the cost of wellness programs are offset by the gain in productivity due to health-related issues. Programs such as easy access to exercise equipment so that nurses would be able to exercise at their convenience if those areas could be open 24 hours for them. Also, weight management classes, smoking cessation classes, and healthy lifestyle coaching were recommended in the literature. And there's also programs that are available many times by the employers to help stress reduction. Conflict management training, as well as assertiveness and mutual respect training. Also, biofeedback and relaxation techniques were recommended in the literature. In conclusion, I will summarize my main points, and then I will be happy to answer any questions that you may have. Nurses should practice healthy behaviors with modifications to the environment. Nurses can decrease their stress by using coping mechanisms and also learning to handle verbal abuse. Healthy dietary options should be available for nurses, and nurses should be able to choose to exercise routinely. Wellness programs available by employers should be utilized by nurses to improve their health and their life. Now, I would be happy to take any questions that you may have.
I know nurses who are overweight, but they don't have any medical problems, and they seem happy. So what's the harm in being a little overweight?
Well, because of our highly functional status, many nurses are biased when assessing their personal health in relation to acute and chronically ill patients that we care for. Many nurses in a survey who were clinically overweight evaluated their overall health with positive ratings, although they also admitted to eating fast food and snacks more than twice a week. The literature also states that many overweight nurses admitted lacking discipline to lose weight. And the literature does state that obesity does definitely increase your risk for heart disease, diabetes, and several cancers. Any other questions?
I'm a nurse, and even though I eat healthy and exercise routinely, I still can't seem to lose weight. So why can't I lose weight?
Many nurses who are clinically overweight claim to practice healthy behaviors. In some cases, there may be an underlying metabolic condition, but many times there is a need for further education regarding healthy diet and exercise habits. I've got time for one more question.
With all of the TV advertisements, fast food chains, and large portions served in restaurants, I'm confused about how much a serving really is.
In our culture, our relationship with food has changed over the years. Portion sizes in restaurants have increased. There's a multitude of prepackaged foods available in the grocery store. We are exposed to high-fat and high-sugar foods with the promise of convenience. In a slideshow presented by the National Institutes of Health, they indicate that a hamburger 20 years ago averaged 333 calories, whereas at present time a hamburger is about 590 calories. I would suggest that you visit their website under Nutrition. There is an area called Just Enough for You. It's all about food portions. It also addresses eating out and also about eating on a budget. I appreciate your time today. That's the conclusion of my presentation. Thank you.